Hi, my name is Zoe Sakellarios, and this is T24's Special Population Presentation, Pathways to Prevention, Creating Equitable Solutions for College Substance Abuse. Bobby Schubert, at the age of 29, after 4 years of sobriety, was found by his roommate slumped over his UCLA dorm room desk. It was discovered that Bobby had taken Xanax pills that were laced with fentanyl. His mother could not help but wonder if Bobby had access to enhanced substance abuse resources at his university as well as nearby Narcan, if Bobby would still be alive today. This presentation aims to discuss the social determinants revolving around substance abuse in college student populations, how technology can specifically help this population, the financial mechanisms involved with increasing of the amount of substance abuse and mental health resources at universities, and the vulnerability framework and the reasons that college populations are specifically vulnerable to substance abuse issues. So, why do college students turn to drug abuse? Well, financial pressures due to raising tuition, academic pressures, and homesickness may prone students to use drugs as a coping mechanism, and due to the widespread availability of drugs. In this table right here, it is very clear that it is very easy for college students to be offered and to gain access to substances at school. So, mental health care spending. We do see in this chart right here that mental health care spending has increased in the outpatient and inpatient sector, while prescription drugs have decreased. So, market justice suggests that resources should be distributed based on the student's ability to pay, leaving low income students with limited counseling resources. And these low income students are the ones that are dealing with paying for their own tuition, maintaining a scholarship, and maybe even being homesick. So, this is leaving the lowest income and most vulnerable students with the least resources. While on the other hand, a social justice perspective would advocate for equitable resources regardless of availability to pay, providing all students with support and benefiting the entire population. So, drug access in college populations. So, surprisingly, on an average day during the past year, 453 part time college students drink alcohol for the first time, and 174 used an illicit drug for the first time. And in this table right here, it is very clear that many full time college students access a variety of drugs and substances on an average day for the first time at an alarming rate. And according to NSD data, 9.9% of full time college students aged 18 to 22 drink alcohol for the first time. And of the 9 million full time college students in the US, 6% used illicit drugs for the first time in the past year. So, personally, I find all of this data extremely alarming. And I'm really hoping that moving forward, we can find improved pathways to preventing all of these increasing numbers and increasing use of these substances. Now, Dennis, take it away.
Thank you, Zoe. To piggyback from Zoe's slide, here we are given data focusing on the percentage of opportunity young adults have with drug substances, and it clearly shows a correlation to the use of a given opportunity as well. The data also shows how most of these opportunities are given and taken during the college years, ages 19 and 22. As people get older, they start to go into their careers and are having less interactions with drugs, and the atmosphere and daily life will be vastly different compared to college. It is also important to note our how as marijuana continues to become legalized in states, its recognition and being harmful has dropped, which shows a really close correlation to our state, Florida, who almost just recently passed a law that legalizes marijuana, further pushing the agenda of making it seem as a non-dangerous substance. But we know that's not the case. In college, by a large margin, it can be noted that alcohol is the most commonly used drug in college, as shown from the data. Almost a whopping 80% of college students are involved in the use, following marijuana for 40% as well. With marijuana becoming legal and more acceptance throughout the states, this percentage is only bound to go higher. It is also important to know how there's a correlation between these substance uses. From the data, it is clear to tell how there is a strong correlation between substance use. On average, frequent binge drinkers are 3 times more likely to smoke cigarettes, 5 times more likely to use LSD, and 6 times more likely to use hallucinogens. It might seem odd at first by just looking at the numbers, but when factoring in the scenario where excessive drinking can lead to these outcomes, it can start to make sense. People who are under the influence tend to say yes and do more things that they'd rather not do in a normal situation, explaining how this data might come to be. It is of importance for universities to make investments in mental health and drug education programs. It can include educating students about risk, provide them options on care, and can be a sense of outlook for them. Here at the University of Florida, they have Gatorwell, a facility where students can come in and seek the help they need in any aspect. However, most of the time, out of pocket payments are required to these healthcare students in these student healthcare clinics, causing a financial barrier for students to seek the correct help that they need, which can further lead them to resort to substance abuse. College age individuals are at a stage where experimenting and risk taking behaviors are more common. Peer influence and social behaviors can lead to increased drug use, and students from diverse cultural backgrounds may face unique stressors, such as balancing cultural expectations with academic pressures, which can increase their vulnerability. In an environment where drugs are all around, it can seem difficult to steer clear from any substance use. To top it off, university is known to be a stressful environment, and there's at most times there's a lot of fault that can lie as to why students lean towards using substances. Hence, the importance of having great health and wellness programs in universities. Other outside factors that are enabling characteristics is the campus environment, the availability of drugs, and the access to support services. Some universities have robust mental health resources, while others may not. Additionally, the frequency of parties and an abundance of bars might contribute to an environment where drug use is more normalized. No matter the kind of student, most find themselves in a state where normal is to partake in drug use. When factoring in how many states are attempting to legalize marijuana, this problem will only skyrocket and cascade to bigger issues. And now here's Tyler.
Thank you, Dennis. Moving on, let's start by understanding why students are vulnerable to drug abuse. Students are susceptible to drug abuse due to the prevalence in the community and easy access to these substances. Additionally, they are even often influenced by friends or even family members. Now, let's see how technology can make new solutions to drug abuse. There are many technological innovations for drug intervention, such as mobile apps for mental health, substance abuse virtual counseling, teletherapy, wearable technology with remote patient monitoring, and electrochemical sensors. Let's focus on how wearable devices can help support students. In addition to the other devices, college students can now sync their health data via Bluetooth using various wearable devices, such as smartphones, smartwatches, to monitor patient vitals and identify signs of substance abuse. Building on more medical devices, let's talk about electrochemical sensors. Wearable electrochemical sensors for the monitoring and screening of drugs are another great preventative way of drug use. These sensors are capable of non invasive monitoring of chemical markers and represent a rapidly emerging digital health technology. Here are some more targeted interventions. Next, we will discuss targeted interventions for prevention. Many telehealth services provide education to those who may be addicted and help find alternative solutions to their problems. By providing education on the risks of drug use and even offering coping strategies for mental health challenges, these sessions empower students with knowledge and resources. They also create a supportive environment where students can discuss their struggles openly, reducing the stigma around seeking help. To add on to these preventive strategies, let's discuss emergency interventions like Narcan. Narcan, also known as naloxone, is a life saving medication that can rapidly reverse the effects of an opioid overdose. Providing locations on college campuses with Narcan easily available can save lives in the event of an overdose. Drug prevention is critical in saving the lives of many college students. The burden is on the universities to make changes in mental health awareness. We also need to shift our focus to the reduction of marijuana consumption. Not only that, we need to reflect on the history to create a better prosperity. focus on preventive care as well. To conclude, this leaves us with an important question. What are the practical strategies that colleges and universities can implement to reduce drug abuse among students? And how can students themselves take an active role in creating a supportive, drug-free campus culture? Lastly, here are references, and thank you for watching.